Allergic rhinitis makes up 30% of all respiratory claims. If you have a runny nose, post-nasal drip, or constant congestion that started or got worse during service, keep watching. I'm going to break down exactly how veterans are getting rated for allergic rhinitis. If you find this information valuable, make sure you smash that like button, subscribe, and share this with a fellow veteran. So, allergic rhinitis is an allergic reaction to triggers like pollen, pet, dander, mold, or insects. There are three types of rhinitis. Symptoms include sneezing, congestion, headaches, an itchy nose, and watery eyes. Vasomotor rhinitis is a chronic, non allergic nasal inflammation causing allergy like symptoms due to hypersensitive nasal nerves reacting to triggers like weather changes or stress. So anytime we dealing with the suffix itis, that's that has to deal with inflammation. So the next thing you want to be aware of is how the VA rates rhinitis. So it's always good to start from the bottom up. So with diagnostic code 6522 allergic or vasomotor rhinitis, a 10% rating would be without polyps, but with greater than 50% obstruction of nasal passage on both sides or complete obstruction on one side. 30% would be allergic or vasomotor rhinitis with polyps. For bacterial rhinitis, a 10% rating would be with permanent hypertrophy of turbinates and with greater than 50% obstruction of the nasal passage on both sides or complete obstruction on one side. And a 50% rating would be rhinoscleroma. To get a 20% rating for granulomatous rhinitis, you have to show evidence of other types of granulomatous infections, Wagner's granulomatosis, lethal midline granuloma. So this is how the VA interprets and rates rhinitis. Granulomatose, a disease characterized by the collection of immune cells. Vasomotor, constriction or dilation of blood vessels. Hypertrophy, enlargement of an organ or tissue from the increase in size of the cells. So it's definitely important when you filing these claims, you want to make sure you got as much evidence, supporting evidence as possible. So these are the type of documents that you can submit to support your claim. So you can submit federal, state records. That could be your military records, your personnel records, Social Security Administration. You can submit some private medical treatment records. That could be, your private physician, doctor report, X-rays, medical labs. And you can also submit supporting statements. So this could be a buddy letter from a service member you serve with, a family member, a friend, law enforcement officer. So all of these could be support evidence for your claim. Once you file your claim, you'll get a CMP exam scheduled and they'll send you a DBQ form. And the DBQ form is pretty much a questionnaire for your disabilities, asking pretty much who, what, when, where, why. So let's go over that. Describe how the condition began. What were the symptoms when the condition began? Have you been treated for this condition? If yes, specify past medications, surgeries, and other types of treatment and describe response to the treatment. What are your current symptoms? Describe the impact of the condition on your ability to perform occupational functioning and ordinary activities. Does the veteran have a benign or malignant neoplasm or metastage related to any of the diagnostic or diagnosis mentioned in the diagnosis section? Surgery, radiation. So it's just several questions and things that the VA gonna want to know. This form right here is the DBQ form that the physician is gonna have to fill out when you go to your CMP exam, either during or after. On the second page, they're going to be asked to select diagnosis associated with the claim condition. So this right here is like a list of different diagnoses that fall under the respiratory system. So you got chronic Sinus is allergic rhinitis, non-allergic rhinitis, bacterial rhinitis. As for the date of the diagnosis, they also going to have to describe your medical history. Describe the history of the veteran's sinus, nose, throat, larynx, or pharynx condition. Has the veteran had repeated sinus-related surgeries? And then it also has a rhinitis section. Is there greater than 50% obstruction of the nasal passage on both sides due to rhinitis? Is there complete obstruction on the left side due to rhinitis? Is there complete obstruction on the right side due to rhinitis? Is there permanent hypertrophy of the nasal turbinates? Are there nasal polyps? Does the veteran have any of the following granulomatous conditions? So these are the type of things that the VA gonna want to know during your DBQ, during your CMP, and yeah. So I hope this helps give you a good idea of what to expect when it comes to your CMP exam, your DBQ, and what the VA looks for as far as rating somebody that's dealing with allergic rhinitis or any other type of rhinitis. So yeah, man, if y'all found this valuable, make sure y'all smash that like button, subscribe, and share this with a fellow veteran.